Part 1. The Sterile Mouth Myth. You brush twice a day and still get cavities. What's going on? Might be the first question on your mind. The answer often lies in a surprising place: your mouth's natural ecosystem. The oral cavity isn't sterile. It normally harbors on the order of 700 species of microbes, bacteria, fungi, viruses, living in harmony. In fact, a balanced oral microbiome helps keep your mouth healthy. Beneficial bacteria crowd out disease-causing germs, aid digestion of foods, and even neutralize acids. For example, NIH researchers explain that good oral bacteria help keep the growth of bad microbes in check, and can protect against harmful microbes in food. In short, a healthy mouth is not germ-free. It needs friendly microbes to defend against decay. Despite what many think, trying to sterilize the mouth completely is actually counterproductive. Over-the-counter mouthwashes and strong antimicrobial rinses do kill germs, but they kill indiscriminately, wiping out both harmful and helpful species. Recent dental research warns that chlorhexidine or alcohol-based mouthwashes can trigger microbial dysbiosis, an imbalance where some species are obliterated and others, often unwanted pathogens, take over. One review notes there is general consensus that alcohol in mouthwash kills both good and bad bacteria indiscriminately. In practice, this means a daily swig of a harsh mouthwash can leave fewer protective bacteria lining your teeth and gums, making the mouth more vulnerable to decay. In other words, that germ-killing mouthwash might be setting you back. By nuking the microbial community, you may inadvertently remove the natural defenses that keep harmful acids and decay in check. Think of it like applying antibiotics when you don't need them. You lose the body's normal flora and open the door to trouble. The sterile mouth myth is that killing all mouth bacteria is good. In reality, research shows a diverse oral biome digests foods and keeps the mouth healthy. The goal shouldn't be zero germs. It should be a healthy balance. In the next segments, we'll see how common, good habits can throw this balance off and literally wear your teeth away. Part 2. Habits 1, 2 and 3. Habit 1. Brushing immediately after coffee or acidic foods. Many people think brushing right after finishing coffee or citrus is helpful. It certainly feels cleaner. Unfortunately, this can actually accelerate enamel erosion. Coffee, juice, wine and other acidic foods momentarily soften your tooth enamel by lowering the mouth's pH. During the roughly 30 to 60 minutes after acid exposure, saliva is busy neutralizing acids and redepositing minerals back into the enamel. If you brush during this vulnerable window, you essentially scrub away softened enamel. Dental experts warn that brushing immediately after acidic drinks creates tiny scratches on the tooth surface, and over time this microabrasion adds up to permanent enamel loss. Once enamel is gone, it doesn't grow back, exposing the yellowish dentin and causing sensitivity. After acid intake, the safest move is to wait before brushing or at least rinse with water. As one dental source explains, your saliva works to neutralize the acid and restore lost minerals. Your enamel remains in this vulnerable state for about 30 to 60 minutes after you finish your coffee. During this window, brushing can literally brush away softened enamel particles. In practice, Dentists now often recommend brushing before coffee or waiting a half hour after finishing your drink. This lets saliva protect and remineralize the enamel first. In short, giving your mouth a breather after acid intake can prevent chronic wear and sensitivity. Habit 2. Overusing whitening strips or bleaching treatments. Whitening strips and gels seem harmless, but overdoing them can literally strip away tooth structure. The active ingredient in most home whitening products is hydrogen peroxide or carbamide peroxide, a powerful bleaching chemical. Experts warn that while occasional, moderate use can be safe, over-whitening is risky. The peroxide oxidizes stains, but in the process it can make enamel more porous and brittle. Overuse of strips or bleaching pens has been shown to damage enamel's microstructure, leading to long-term sensitivity. One science article bluntly states that going too white can damage enamel, burn gums, and cause long-term tooth sensitivity. Another report warns that chronic overuse can even cause permanent tooth erosion and gum burns from the bleaching chemical. Even worse, aggressive whitening permanently thins the enamel. As the Scientific American piece explains, bleach makes enamel more permeable or even porous, allowing the yellow dentin underneath to show through. With enough bleaching, the enamel layer can become so thin that teeth turn translucent at the edges. This defeats the purpose of whitening. You end up with thinner, weaker teeth. It can also chemically irritate or burn the gums if not applied carefully. The takeaway is not to fear every whitening treatment, but to avoid excessive use. Even dental professionals recommend waiting months between whitening sessions to let enamel recover. In summary, frequent, heavy-handed use of whitening strips or gels can strip away enamel and lead to sensitivity and decay. Habit 3. Mouth breathing at night. Dry mouth. Breathing through your mouth all night may sound harmless, but it can drastically dry out your oral environment. Normally, saliva bathes and buffers your teeth. When you sleep with your mouth open, saliva evaporates and the mouth becomes arid. Dry conditions let decay, causing bacteria flourish. Studies confirm that people who mouth breathe build up more plaque and have higher levels of Streptococcus mutans, the bug most tied to cavities, than nose breathers. In one controlled study, mouth breathers were found to have 4 times the risk of heavy S. mutans colonization compared to nose breathers. In practical terms, a dry mouth is an acid-producing playground for bad bacteria. It also inflames gum tissue. Chronic mouth breathers often wake with sore, bleeding gums. Colgate notes that mouth breathing may hamper your oral health by causing dryness, plaque buildup and decay. In short, if you wake up with cotton mouth and morning breath, it's not just annoying, it's a sign your mouth's defenses are down. Saliva is your first line of defense against acid and microbes. Without it, the balance tips toward cavities. Addressing chronic mouth breathing through nasal allergy treatment, positional therapy, or oral devices can help maintain saliva flow and keep the oral microbiome balanced. Otherwise, regular dry mouth can silently undermine all your other good habits, leaving you more prone to decay. References: scientific studies and professional guidelines confirm each of these insights. Habit 4. Frequent snacking and acid attacks. The narrator explains that eating frequently, even healthy, snacks keeps oral bacteria busy producing acid, which erodes enamel. Every time you consume carbs, plaque bacteria ferment them and the local pH falls rapidly below the safe level, around 5.5, beginning demineralization. It typically takes about 30 minutes for saliva to neutralize this acidity, so constant nibbling never lets pH recover. In fact, studies suggest that how often you snack can matter more than the amount of sugar eaten in predicting cavities. To protect your teeth, give your mouth time to recover between meals. Salivate and remineralize. 1. Limit grazing. Saliva needs roughly a half hour after eating to rebalance pH. Try to space snacks at least 30 to 60 minutes apart. 2. Drink water or cheese. Rinsing or consuming cheese, milk with snacks can help neutralize acid. 3. Focus on meal timing. Fewer, larger meals let your mouth stay neutral longer. Research shows more frequent snacking is linked to higher decay risk. By cutting back on constant grazing, you allow saliva to buffer acids and give enamel a chance to recover. Habit 5. Ignoring bleeding gums and systemic inflammation. The narrator notes that bleeding or swollen gums are not normal. They signal gum disease, gingivitis, periodontitis. Chronic gum inflammation produces a flood of bacteria and inflammatory compounds that can enter the bloodstream. This systemic inflammation contributes to arterial plaque and cardiovascular strain. In fact, people with untreated periodontal disease have about 2 to 3 times the risk of heart attack, stroke or other serious cardiovascular events compared to those with healthy gums. Scientists now recognize that the oral microbiome and gum health connect to overall health. Dysbiosis in the mouth has been linked not only to heart disease but also to diabetes, rheumatoid arthritis and more. In short, ignoring bleeding gums invites more than just tooth loss. It can raise inflammation body-wide. 1. Warning signs. Bleeding on brushing or flossing means infection. Don't dismiss it. See a dentist if gums are red and tender. 2. Inflammation link. Chronic gingivitis drives systemic inflammation, atherosclerosis. 3. Whole body health. Research shows poor oral health correlates with higher rates of heart disease, diabetes and other inflammatory conditions. Addressing gum disease early, improved brushing, flossing and professional cleanings can literally save your heart as well as your teeth. Part 4. The Probiotic Solution. Restoring balance. The narrator explains that modern oral care, antiseptic mouthwashes, antimicrobial toothpaste, kills indiscriminately, often wiping out beneficial microbes along with pathogens. Recent studies report that powerful mouthwashes, e.g. chlorhexidine, can cause microbial dysbiosis, killing off some species and allowing others, even undesirable ones, to dominate. In effect, we clean our mouths but fail to repopulate the good bacteria afterward. Over decades, the approach has been, kill the germs, yet overall U.S. oral health hasn't improved significantly. It's now clear we need a new strategy to reseed the mouth with protective microbes after brushing and flossing. Probiotic therapy does just that. Scientists have shown that certain probiotic strains can inhibit cavity-causing bacteria and rebalance oral biofilms. For example, Lactobacillus paracasei, one of the strains used in oral supplements, has been found to effectively reduce Streptococcus mutans levels and crowd out pathogens. In general, clinical research finds that targeted oral probiotics lower harmful bacteria and slow decay. They form benign biofilms that act as replacement linings, making it harder for acid-producing germs to settle. In short, probiotics can rebalance the oral ecosystem and help guard enamel from within. 1. Balanced biofilm. Clinical trials report probiotic strains, like L. pericaceae, can inhibit S. mutans and restore a healthier plaque community. 2. Protects enamel. Probiotic supplements often include minerals, e.g. calcium, phosphate, to aid remineralization, working synergistically with the bacteria. 3. Continuous support. Unlike brushing, a one-time daily cleaning, a dissolving probiotic lozenge or paste provides 24/7 protection by seeding good bacteria around the clock. For example, a new probiotic mineral melt, a small dissolving lozenge taken each morning, has been formulated for this purpose. This 3-second candy contains clinically studied strains, including L. pericaceae, plus calcium minerals. As it melts, it actively recedes the mouth with beneficial microbes and delivers minerals to teeth. Over time, this gentle supplement can help rebuild the natural flora and strengthen enamel, complementing brushing and flossing. We encourage viewers to consider this soft approach. Adding a probiotic mineral lozenge to your daily routine can be a smart, science-backed step toward oral health. Of course, continue regular dental care and consult your dentist for personalized advice. Learn more by following the link below. It may be the easy, preventative step that keeps your smile healthy without costly procedures. Sources: Current Dental Research and ADA Guidelines.